I read an article called Communication is Critical in ICU Nursing. In this article, it talks about the importance of communication within the ICU. In the ICU, nurses communicate with several people, including the patient, the patient's family, other nurses, and doctors. In the ICU setting, not only is verbal communication important, but so is nonverbal communication. Not only are these two types of communication important, but so is the use of technology for communication, such as a cell phone, iPad, and handheld gaming systems for children. In the article, it talks about using nonverbal communication for patients who are unaware of their setting or heavily medicated and cannot verbally respond back. In the book, on pages 145 and 146, it talks about touch messages and their meanings. It explains how touch can communicate support, affection, greetings, and playfulness. In the article, it talks about a therapeutic touch and smiling to communicate with the patient. It has been shown that patients who can't talk respond well to this. Another example of communication in this article talks about the nurses doing their daily rounds. During their rounds, the doctors and nurses get together to discuss the status of the patient and if there are any changes. Sometimes the family of the patient is involved. On page 177 and 178, it talks about communication with the grief-stricken. This relates to the article because it talks about letting the person or family express their feelings and concerns. This lets the family know the nurses are there for them to answer questions or concerns. In the article, it talks about using modern technology to communicate with patients. Such devices include cell phones and iPads. Even though most hospitals don't allow cell phones in the ICU, it can be allowed if texting is the easiest way for the patient to communicate. On page 236 and 237, it talks about how cell phone and modern technology are a way of life, although in some cases it can cause poor communication skills. However, in the ICU setting, modern technology such as texting can be very helpful. I knew communication for nurses was very important. However, I didn't realize that there were so many different ways for a nurse to communicate. I learned that when communicating with pediatric patients, it is important to make them feel comfortable in their surroundings and to communicate with them at their level.